Okay, fine. So I'm not going to talk about obesity and hypertension or hypertension and obesity management because that wasn't actually the topic given to me. What I want to discuss with you here is really this whole idea about obesity being a disease. How many of you've heard about this? People are saying, everybody's heard about it. Okay, great. I want to actually give you some arguments. If you ever get into an argument with somebody who says, well, now obesity is not a disease, it's just a risk factor, it's just lifestyle, it's just guys who are too stupid to get off their butts and eat properly. If you ever hear that from anybody, I want to give you the arguments that you can hold up against them. So, just incidentally, right now I work in obesity, but some of you might wonder, what makes me the obesity expert? Because there really is no such thing. You can't go to medical school and become an obesity expert. In fact, I trained in medical school in internal medicine and nephrology, and I really didn't know much about obesity till 20 years ago, so when I started having some research interest, and that research interest was about obesity and hypertension. So the question was, why does your blood pressure go up when you gain weight? Nobody really knew. We figured that out now, and if you want to know, you can come up and talk to me after my talk. I don't want to waste time on that. It's a very interesting story. But then I really realized that when you run a hypertension clinic or a cardiology clinic or a diabetes clinic or in fact, bone and joint clinic, most of the patients that you're seeing, carry excess weight. And excess weight is a problem. And I didn't know much about it. I approached it, I said, let's just tell people to eat healthy and, get some exercise and the problem will go away, which obviously didn't work, which got me, first it irritated me and then I had to learn about it. And now I think it's actually very exciting. Here are my disclosures, lots of disclosures, perhaps not enough. I work with a lot of companies trying to come up with medications for obesity, and I hope that by the end of my talk it will become clear why we urgently need something in that working. Because, as much as we understand that obesity is a common problem, we have to accept that we've got pretty lousy treatments. And that is, if there's a single unmet need in all of medicine at this point, at this stage and age, it is effective treatments for obesity. We just don't have them. The ones we have are not scalable, so I'll talk about those. All right, here we go. Obesity is not a new problem. Obesity has been around forever. If any of you have ever been to the the Museum of Natural History in Vienna, you'll see this little figurine, which is only about this big, but it's about 30,000 years old, Stone Age. So those guys knew what obesity looks like because this could be any of the patients who walked through my door. I work at a bariatric center, so the average patient in my clinic has a BMI of 50, average. Okay. So, but they look exactly like this. So this is not a new phenomenon. It's not that obesity suddenly came out of nowhere. What has come out of nowhere is the increase in obesity that we've seen over the past decades. And what's really, really scary for most of us in this field is not so much the problem that everybody's carrying a few extra pounds, by all means. In fact, there's a lot of data now showing that there's been a shift in what we used to think of as healthy weight, that perhaps even close to a BMI of 30, you can be pretty healthy and it probably has zero impact on your life expectancy. That doesn't happen until your BMI really starts going up to 35 and 40 and above, right? Unfortunately, that's exactly what we're seeing. So across Canada right now, we're not so concerned about everybody getting 2 pounds heavier. We're concerned about the fact that people who are already heavy are getting heavier, and they're getting heavier at a tremendous rate. So my problem is not how do I keep the guy with a BMI of 25 at 25. I don't care. My problem is how do I make sure that somebody who's already at a BMI of 35 and 40, how do I keep this guy from going to 50? Lots of people like that, and that's really the acute problem. So we have a problem. We have an epidemic of severe obesity, and just to give you the numbers, we're talking about severe obesity, BMIs 35 plus. Right now is about 2.5% of the population. That number is going to double within the next 5 to 10 years. Think about it. That's going to be a large number. You better get bariatric seating for your practice because you're going to need it. Here's the latest. A lot of you might not have heard about this because this was an announcement by the Canadian Medical Association that came right on the day before Thanksgiving, on Friday afternoon. So the media didn't catch up on this. Nobody even found out. It was like a secret. Maybe they were a little bit too embarrassed to say it. I don't know. But this is what they said. obesity is a disease, and if you read the fine text here, it says not just says it's a disease, it also tells you it's a chronic disease, and that's going to be a very important part of what I'm going to talk about. So the Canadian Medical Association has now come out and said obesity is a disease. They've declared it a disease. I didn't know they could declare stuff, but that's what they did. Which is nice, but they were not the first. This is not like some brilliant new idea that these guys have suddenly had. The World Health Organization has been talking about obesity in the context of non-communicable chronic disease for at least 15 years. It's always been in their NCD sort of arena. The American Medical Association came out with saying it's a chronic disease a couple of years ago. That made a big headline. Everybody was all over it. The FDA has recognized obesity as a chronic disease. The American College of Association of Clinical Endocrinologists came out and said it's a chronic disease. The Canadian Obesity Network has been saying this is a chronic disease for a long time. Now we have the CMA, so I guess now that they've declared it, it's a chronic disease. I'm not going to talk about why we have this problem. I thought I'll just show you the summary slide. It's complex, okay? There's a whole bunch of different things that happen here, with food production and whatnot. Let's not get into it. We know this is a societal problem. We know that one of the key reasons why we didn't have an obesity problem back in the Stone Ages was because people in the Stone Ages did, they were lucky if they actually hit age 30. So a lot of things have changed. They didn't have processed foods. They didn't have, they didn't have smartphones and sitting in front of computers and stuff. So lots of things. Let's not get into that. I want to focus on the biology because I think what's really important is the biology. The Obesity Network, which by the way has a new logo also starting this month. So if you know of the old maple leaf thing with the measuring tape, we got rid of the measuring tape. We're sending the wrong messages. The new logo. There's a website. You can get free professional membership, which means you just go there and sign up. But it now has a section for your patients. So if you have patients with excess weight and you think they need to find out about stuff, you can send them to this website. The Obesity Network's been doing a lot of things. One of the things that we've done is we've actually developed a whole program for obesity management in primary care. It's currently being evaluated at a large PCN in Edmonton. There's been 40 clinics, randomized, controlled trial kind of cluster randomization. And one of the things that's been absolutely apparent is there's virtually no obesity management going on in primary care. But what we're also learning is we can change that. And when we change it, things start to happen. Now, because of the topic that was given to me, I'm not going to be talking about this. I run full-day workshops on obesity management in primary care. So, maybe those will come to town and you can come back for that one. Here's how I look at obesity. The first thing is, I don't look at it as one problem. I look at obesities as a much more complex problem because it is a very heterogeneous condition. There are lots of different reasons why people gain weight. This can start, genetics is important. We're learning about epigenetics. We're learning about, mental health issues. We're learning about all of the problems, medications that cause obesity, lack of time causes obesity, lack of sleep causes obesity, and I'll show you a couple of other things that you might not know about that cause obesity. Very heterogeneous. People gain weight for